I agree with you. Your thinking is clear there, because if you find endpoints that are much easier to, because the truth is that all the studies we've done on remote prayer. Listen, prayer is good for you. If you get sick, pray. You know, it does seem to give people a positive attitude, and you know that can mean a lot when it comes to feeling better. But all the studies on remote prayer, in other words, you praying for me to get better, you know, have failed. And I would expect that. Listen, as a doctor, I've said this before, and it offends some of you, but I'm sorry, it's the truth. I've seen some of the most wonderful, God-fearing, caring, religious people, you know, that I've loved as patients, and they die, you know, horrible, miserable, painful deaths as frequently as people who are non-believers. So that's just the way it is. It's kind of discouraging in terms of what I think most people would want from a, quote, involved living God. It's discouraging. I'll just leave it. I'll leave it at that. Carlos, Dr. Dean Edelt, welcome to the program.
Oh, hey, doctor. How you doing?
Fine, sir.
I have a question for you. I'm not circumcised, and you were talking about the moist earlier in the program. And my question is, I do use the same deodorant that I use for my armpits. I use it, you know, down there. And sometimes I'm kind of wondering if I'm doing this right, or I'm kind of damaging this by because of the chemicals. And you know, and if that is the case, what can I use to avoid the moist?
Carlos, it's rare anyone asks me a question here I've never been asked before. So you're about to win a prize. It's a fascinating deal. First of all, my question is, does antiperspirant, does it work? Because the mechanism for the production of moisture, I have to call Marilyn for this one, it's not sweat glands. Yet they could be modified sweat glands, and the moisture has often to do with the fact that it's just a sealed off area. So my first question, do you think it works?
It feels like it works because it stays dry much longer than normal if I don't do anything, if I don't use it.
Right.